Hello, good evening. Dr. Chudi Ufondu of Snowspirations Global Health Solutions. Thank you and welcome to our midweek open clinic, Keeping It Real with Dr. Chudi on YouTube. Now, today we're going to talk about bad breath and what we call halitosis. Bad breath and halitosis. I know it's not your regular favorite topic regarding fertility, but we have to start talking about things that affect us on daily basis. Now, you need to know the difference between bad breath and halitosis. Halitosis is actually a medical condition that can affect you, affect your confidence, affect your relationships, including your sexual relationship, including your courtship, including your family, including your friends, including your colleagues. No one wants to be avoided. No one wants to be coming in and everybody is leaving. So we're going to talk about bad breath. What are those things that might likely predispose you to having bad breath? How can you differentiate between bad breath and halitosis? What can you do to prevent halitosis and bad breath? Very important topic. So please, when you come in, let me know who you are, announce your name, announce your location. I'm going to quickly run the clinic. Then when I'm done, you can ask your question. So we're going to start. You see, I'm sure you've woken up in the morning and you felt a very bad, pungent smell coming out from your mouth, coming out from your whole buccal area. Is expected. Now, because the mouth is connected to the anus, that's your alimentary canal, there are certain things that happen inside your mouth when you're not talking. There are certain things that happen inside your mouth when you are sleeping. So it's expected that when you wake up in the morning, you will have a bad breath because when you eat, there are so many processes that go through the whole body, through the process of digestion, through the process of absorption, through the process of making fecal material. So it's still what you put in your mouth that will eventually pass out through the anus. So it's not unusual to experience bad breath in the morning. But the question is, when after taking your normal morning routine, you've brushed your mouth and you step out, and someone that actually likes you, is actually people that like you that might, find a way to tell you, oh, what's going on with your breath? Or maybe your mother or your sister or your partner, they will tell you, hey, what's going on? You have a bad breath. Now, bad breath and halitosis, they are used interchangeably, but there is a very big difference between bad breath and halitosis. Now, bad breath can be temporal. So like I mentioned, when you wake up in the morning, if you don't brush your mouth, definitely you're going to have bad breath. If you ate garlic, if you drank coffee, if you drank a lot of alcohol the previous night and you have not taken your bath and you have not brushed your mouth, you can have bad breath. Now, when we talk about halitosis, halitosis is a longer thing, is a longer condition that goes beyond even when you use bubble gum, mint, and what have you, and you still keep feeling that pungent, very nasty, very disturbing smell, which can scare people away. You might be the most beautiful bride, you might be the most beautiful guy out there, the most handsome guy out there, but nobody wants to hang around someone that when they speak, people run away. So the most important thing you have to understand is the fact that there are some preventive measures you can take that can prevent you from developing this on a chronic basis. So in medical condition, I want you to be conversant with chronic condition and acute condition. So we just want to deal with only bad breath. We don't want anybody to have halitosis. Now, halitosis is actually caused by sulfur-producing bacteria in the tongue and the mouth area, in the tongue, the throat, and the mouth area. So if your mouth harbors a sulfur-producing bacteria, anything that contains sulfur can be very, very pungent when you perceive it. Very bad odor. So bad breath is often caused by inadequate brushing, mouth, morning breath, food debris, alcohol, or smoking, These are temporal situations. But when you have halitosis, halitosis is a chronic condition which can be due to tooth decay. It can be due to the bacteria I mentioned. It can be due to food debris that got stuck in your tongue, in your gum. And unfortunately, halitosis cannot just go away when you finish brushing. We have to find what the problem is and we begin to address them. So halitosis, it's a more longer thing compared to bad breath. You can take your breath, you can brush in the mouth, and your bad breath will go away. When it doesn't go away, then we need to know what's going on. So unlike morning breath or strong smell that lingers after taking tuna, after taking garlic, halitosis will be around for an extended amount of time. Now, what are the major causes of halitosis? I've already mentioned the sulfur producing bacteria that colonize your mouth, your tongue, and the throat area. Now, some people can have dental problems. So some people can have a dental problem we call periodontitis. This is an infection around the teeth. Or poor oral hygiene. That means you are not brushing more than once a day. The recommended number of times you're supposed to brush every day is twice. But guess what? Majority of us, including me, sometimes I even manage to brush once. And I'm just keeping it real. Only few people form that habit of brushing more than the one you brush in the morning. So over time, we're going to learn how to do things better so we cannot predispose ourselves to developing halitosis. Now, halitosis can also be due to dry mouth. So when you have dry mouth, which can be due to maybe a drug you're taking or alcohol or stress or medical condition, the drier your mouth, the more the possibility you produce a lot of things which will make you to develop halitosis. Now, people that smoke, over time, when you smoke, you are depriving your mouth of enough of oxygen. And when you don't have oxygen in your mouth, the bacteria that thrive where there is no oxygen will multiply. Now, there are lesser common causes of halitosis. These ones are short-lived. So when you have regurgitation of food, like when you eat and you belch and a couple of acid, leaves your stomach and comes into your mouth, you can have, little stench here and there. Post-nasal drip. For example, due to chronic sinusitis. Now, some people that also have kidney failure or some cancers or metabolic disorder or some medical conditions can also have halitosis. Now, some food, you should be aware of this by now. Your onion, your garlic, your cauliflower, they can induce very bad odor. So, however of this stuff you have can be short-lived or they can be for a long time. Now, what are the symptoms of halitosis? A white coating in your tongue. So after brushing your mouth, you still notice some white coating in your tongue. That might be a sign you might have halitosis. Dry mouth, build up around your face, post-nasal drip or mucus, morning bad breath and burning tongue, thick saliva and constant need to clear your throat, constant sour, bitter, metallic taste. These are all signs you might have halitosis. Now, what is the effect of halitosis? When you have halitosis, it can affect your confidence. You might be the prettiest lady in the community. It might be the prettiest lady in your family. But when people identify you as someone that has mouth odor, how will you feel? You don't want to come out. When you're coming, people are running away. You're too conscious of yourself. So it's something that can badly, badly damage your brand, damage your image, damage your beauty. So the earlier you seek help, the better. Because bad breath and other people can run away from you, this will create a very strong sense of isolation, which in some people can lead to depression. I'm telling you things that can damage your relationship. So how do you treat halitosis? Treatment is dependent on the underlying cause. Now, unfortunately, it's not a quick fix. There is no one treatment that will take care of all halitosis. It would depend on what's causing the problem. Now, by default, when you avoid dehydration, when you have good oral hygiene, when you brush twice and floss, it's very important. It will help you. Now, people are very mindful. Some people use a lot of mouthwashes. Some people use on lozenges. Some people use on specific toothpaste to fight halitosis. But guess what? This is a long-term thing. we have to go and find what the root cause is. You can use mouthwash, bubble gum, and toothpaste to take care of bad breath. But when you have halitosis, we need to get to the roots. Now, couple of days, when you do it over time, a variety of tongue brushes, scrapers has been recommended over the years, so they can help you. Now, some people don't brush their tongue when they are brushing their mouth. They just focus on the teeth. It's important you brush your tongue. It's important you know how to floss. It's important you goggle and make sure that you remove all the food items. Possibly before you sleep in the night, make sure after eating you brush your mouth. You make sure you don't have remnants of food items that got caught in your gum and your throat, because that's what's going to cause that problem when you wake up in the morning. Now, people that have chronic sinusitis, you might find they need to use nasal saline spray. It can be very helpful. Now, some people might need prescribed antibiotics, which can work against the sulfur-producing bacteria. An example of antibiotics that can take care of this is what we call metronidazole, your favorite flagell. So your doctor can prescribe this specifically. Now, you have to form the habit of seeing a dentist. So many people do not go to the dentist until they have a need to remove their teeth. That's not a good thing. Form the habit of going to the dentist. Form the habit of going for your regular, washing your teeth and cleaning and all that by professionals. It helps. So when you ensure you clean your mouth, your teeth, your gum regularly, you are predisposing yourself to preventing things that will not happen. So it's recommended that everybody at least twice in a year, please have checkup for cleanings, for checkups with your dentist. So many people have not seen their dentist ever. So many people. It's not something we do regularly. We feel, just on need basis. But please work on this. Now, if you notice your breath lately has been, smelling, please start by daily routine, brushing twice in a day with fluoride toothpaste. Your toothpaste must contain fluoride. Now, clean in between your teeth. Floss. Drink a lot of water. Don't be dehydrated. Some people can chew sugarless gum. Cut down your alcohol consumption. Cut down your highly processed food. Be mindful when you eat your onion, your garlic, and all that. Over time, they can make you to have a permanent, very, very bad odor that people will want to avoid. You might be the best person out there. You might be the most loving person out there. But when you smell, people will run away from you. So when you apply the above steps, it will help your saliva to be easily flowing around, because when you have lesser saliva, you will predispose yourself to having bad breath and also halitosis. Now, if you notice that after doing this, your bad breath and the halitosis persist, then you need to book an appointment with a dentist. Both of you can track and see where the problem is coming from. So with proper cleaning and examination, your dentist can rule out any oral health problems and advise you on the next step, including different dental products and different dental procedures you need to go for. So it's important you make it a point of duty to regularly go for your dental checkup, because when you do this, we can discover what the problem is, then we can begin to give you solutions on time. Okay? That's my presentation this evening. I know it's not your regular bread and butter, but very important. You have to take this very, very important. Now, some people might not even know they have bad odor, because some people might have, smell problems. Some people are not sensitive. There are some people that no matter what's happening, they can't smell smoke, they can't smell bathing, they can't smell perfume, they can't smell food. Some people have that problems. So it's only a caring, loving person that will call you aside and tell you, hey, you have body odor, you have mouth odor. Let's go and find out what to do. So you need to be mindful. No matter how pretty you are, no matter how beautiful you are, this can damage a relationship. This can damage a marriage. This can damage a very loving relationship. So be careful. And it can happen to both genders. It's not just women. It's not just men, even our kids. So we need to form a very good habit of encouraging healthy approaches to everything we do on a daily basis. Okay? Guys, the clinic is open. Please feel free to ask your questions now in real time. Start asking your questions. We have about 15 minutes to ask questions. After this clinic, I'm going to go to our Facebook and I will repeat this clinic. Remember, on the 25th, we have a special event. I know so many people have been clamoring for twins, for triplets, for quadruplets. We have designed a special event on the 25th of this month, Multiple Pregnancy Summit. Multiple Pregnancy Summit. There are so many people that will complete their family in 2023. They will become pregnant once and they will have their twins and they will have their triplets and they will have their quadruplets. And that's the end of the discussion. This is what I know. So if you want to acquire higher knowledge, if you want to change a good attitude, if you want to change your practices, your perception regarding starting your family, why don't you register on the 25th? Registration is currently ongoing. Registration will end on the 16th. Coming up, then we'll have a little bit of extended registration up to the 24th. So register now. When you're coming, come with your partner. Come with an open mind. There are some women that will have multiple pregnancy by default, by nature, just by their gene makeup. Then there are some women that might need help. Majority of the multiple pregnancy you're seeing in our society today, they got help. And you can also be a twin mother. You can be a triplet mother. You can be a quadruplet mother. Don't just think about it. Don't just pray about it without taking actions. I want you to take actions today, okay? Sometimes it seems like the odor is from the body, not the mouth. What's the cause of body odor? Now, this is another topic for another time, but it's still in keeping with personal hygiene, okay? Now, when your body mixes with the external factor, like your sweat can smell. So when you don't have a good hygiene of cleaning up, especially women, now when it accumulates, it can be a focus for infection, especially the bacterial infection. So the same sulfur-causing bacteria, the same sulfur-mediated bacterial infection that can lead to this very bad smell can also colonize your body, especially the pubic area. So your armpit, your groin, and the crevices, especially if you're bigger. If you have a lot of body weight, anywhere anything can go and hide can be a focus of smell. So body odor is an extension. The reason why mouth odor is deadly is because it's coming from the inside of you. But body odor most times is external. So it's a topic I'll probably take up, some other time. But let's focus on mouth odor, which is bad breath and halitosis. But it's the same pathway. Okay? So that's why you have a lot of antiperspirant, deodorant, cleaning yourself, especially women. Women should be ultra hygienic because even when you're bleeding, if you don't form the habit of changing your undies and changing your pad regularly, when your blood accumulates in your body, your blood can smell. Blood can smell badly. And when you have a very good hygiene, any area you have opening in your body can smell. Your mouth can smell, your nose can smell, your ears can smell. So any opening in the body is an avenue for foreign things to go in there and colonize. So be careful, okay? All right. Evening. Is it okay to use toothpaste that contain fluoride for toddlers? Now, there are age-specific toothpaste. Of course, you can use what adults can use. So there are different contents, different ingredients for kids, youth, and adults. So when you're buying toothpaste for kids, make sure it's age-specific for them. They can use adult toothpaste, of course. Okay, so you need to be careful. Now, there are some prescribed toothpaste. So there are some toothpaste that might contain more than what an ordinary toothpaste might have. It's mainly used for kids that might have a need for that. Now, let me tell you something you should know by now as a parent. I remember when my kids had their adenoids and their tonsils swollen. Now, when any kid out there has any of those adenoids or tonsils swollen, when we don't notice it, you notice that they are having very bad odor. When they talk, you can feel it. Now, in course of removing it, anytime you are placed on nail per oral, so most people that fast, if you notice, they have mouth odor. Why? Because they produce what we call ketone bodies. So the longer you don't open your mouth and you drink something or you eat something, the more your mouth is incubating and changing a couple of things. Okay, so be mindful the type of toothpaste that your kids are using. Can hormonal changes lead to bad breath? Somehow, to an extent, but not directly, that I know, not directly, because remember when we're talking about mouth odor, we are talking about the gastrointestinal system. Okay, so there are still a couple of hormones that will play a role in the normal digestion of food and all that, and production of acid, but not directly. I love that question, Kenneth. Please keep asking your questions. Keep asking your questions. You still have 10 minutes. Ask your question. This is a very important topic. If today is the first day attending my clinic, I normally show up on Tuesdays, 6:30 p.m. Eastern Time, 11:30 p.m. Nigerian time. And shortly after that, I go to Facebook from 7 p.m. Eastern Time, which is 12 a.m. in Nigerian time. We have about 30 minutes, talk, then we disperse. So every Tuesdays and every Saturdays. Saturdays are coming a little bit early. I come in at 12 p.m. Eastern Time, which is 5 p.m. Nigerian time. So make sure you subscribe, make sure you watch other videos, make sure you comment, make sure you share this channel with anybody that wants to learn. It's free of charge. Okay? But keep asking your questions. Keep asking questions. Do you have more questions? Feel free to ask your questions. I'm waiting for your questions. Hit me up. Mbono Adeze, do you have any questions? Can halitosis indicate a more serious medical problem? Yes, it can. Like the dental caries, like gum disease, like periodontitis, they are all problems that can come based on halitosis. So halitosis is a chronic thing. So when you have gum disease, when you have bad flu, when you have a decay, or there are some cancers. There are some oral cancers that might come in with bad breath. There are some people that might have metabolic disease. There are some people that might have autoimmune disease, and it can present with halitosis. So the answer is yes. So it might be a sign that you might be having a medical condition. This is why you need to make it a point of duty to see your dentist frequently. Unfortunately, mouth cancers are one of the commonest cancers out there, tongue cancers, and if you don't go for your dental checkup, you won't even know. So your lifestyle can also predispose you to developing this. So the answer is yes, Kenneth. Very important question. And the answer is 100% yes. So it can be a sign of more severe medical condition. Okay? All right, guys. Keep asking your questions. Keep asking your questions, please. We have 8 more minutes. So relax. Ask your questions. I'll provide you feedbacks. Now, if your questions are not related to this topic, it's still okay. You can ask me your questions. I'll provide you feedbacks. Okay? All right. Tosi, do you have any question? Mbono, Pretty Jane, ask your question. Don't just attend. Just attend. Don't just attend for attending sake. Ask me questions. Not that I know halitosis. I can't really, I don't know if it's hereditary or not. So for now, there is no body of literature that suggests it might be hereditary. However, there are a couple of medical conditions that can be hereditary, like cancers can be hereditary. So if you develop any of those chronic medical conditions, yes, they can present with halitosis. The halitosis as a separate entity is not a hereditary condition. I love that question. Tosi, you're really, probably you might go back to medical school. That's a very, very tough, very important question. I love that. Guys, keep asking questions. Ask any question. We learn every day. I learn from you guys. Every day I teach, I learn. Okay, so guys, ask your questions. We have about 6 more minutes. 6 more minutes. If you don't have any other question, then we're going to adjourn for today. But thank you so much. Keep learning. So we're going to find another topic on Saturday. I will come back and we talk about it for 30 minutes. But remember to subscribe. Remember to like. Remember to comment and share. So subscribe, like, comment, share. So people can learn a lot of free things in this place. So many helpful videos out there. There is no way you will go to our channel and you won't have a lot of good feeling, because there are so many free information, so many educational stuff that can help you to know your body better and become a better person. Okay? All right, guys. Do we still have any questions? If we have any other question, please feel free to ask. If not, we're going to adjourn. Okay, so I will take it as a yes. Okay, so guys, please start transitioning to Facebook. In next few minutes, I'm going to repeat this clinic in Facebook. So the population in Facebook, it's way bigger than the population we have in our YouTube. So we always want to make sure that people benefit from both our YouTube topic and our Facebook. So please gravitate towards Facebook, and very shortly I will show up on our page. So I want you to follow me on our page. Make sure you register for the event coming up on the 25th. You don't want to miss this. Your troubles might end in next year, and before you know it, you've completed your family. So I'll see you guys shortly. Thank you so much, and bye-bye for now. God bless.